COVID-19 could be taking a toll on your kidneys. Dr. Ashita Talwani, a doctor at UAB, explains how the virus is impacting patients and putting a strain on the availability of dialysis supplies. Take a listen.
And what we're finding across the country is that the demands of these patients for dialysis is meeting the capacity of most of these institutions. And so there's already been multiple reports, especially in New York, of not having dialysis machines, not having dialysis solutions, tubing, filters. And then you have to think about the training too. Dialysis requires a special nurse to be able to do that. And if a nurse becomes sick with COVID, there's no one who can provide that therapy.